Well, welcome back. It's still Monday, the 16th of March. Now, this pandemic that's going on at the moment will come to an end and things will go back to normal for most of us. But life is going to change for the next few months. And I don't think there's really any way we can get around this fact. And our priorities have to change for the next few months as well. So for the next few months, we've got to be looking at how we're going to help most people through this condition. And that means we're going to need to change our priorities. So life's not going to be so much about making money or doing things like that. It's more going to be about how can we help people that are weak and how can we help people that are struggling. Because human beings work together. This is what we do. So in a couple of years' time, you can look back and say, you know, when that COVID-19 disease came, I was greedy, miserable, looked after myself, didn't really help anyone else and didn't come out of it very well at all, really. Or in a couple of years' time, you can look back and say, well, no, I stepped up to the mark here. I did the right thing in this infection. I protected others from infection. I helped people who were struggling. That's what we need to aim for. We need to work together on this. Quite a few questions that are starting to clarify now. So it's looking like you can't catch this infection twice. So there's been quite a lot of discussion about this. Can you become reinfected? And it's starting to look like now that the patients that were apparently reinfected actually hadn't shaken off the infection fully the first time. Now, most people reduce their infectivity after about 7 days after the onset of symptoms. But not everyone. It seems that not everyone clears the virus effectively. In some people, it may take longer. So they might stop being symptomatic, but the disease can still kind of rumble on in some people. And it looks like they've been retested and it looks like they've been reinfected, when in actual fact, they just probably haven't cleared the virus the first time. And certainly from the studies that's coming out now on antibodies, the immune proteins that the body makes in response to the infection seem to be indicating that you can't catch this twice. So what I'm expecting now, and I think what most people around the world are expecting, is once you've caught it, you should be immune. And the time you'll be immune for will probably vary from 1 year to a lifetime. We don't know. I would imagine you'd be immune for a long time after you've caught this once. So it's looking like you can only catch it once. Now, I don't think you can catch it from animals. Now, having said that, someone could cough on your dog and then you could pat your dog and get it in your mouth. So animals could act as a way of transferring the disease from one person to another. But it's looking like we're not getting this disease from our animals at the moment. Now, in war, you do whatever you need to protect your people. That's what we just talked about. We need to do extreme things to protect people. So here we've got Joe Biden saying that in war we do whatever we need to protect our people. This is like a war we are in. We are in it together. And John is saying, that's me, we need to reorder our priorities for the next few months. We need to reorder our priorities. Now, 100 million people in Europe are currently locked down, many isolated in their homes. Now, South Korea has had a vigorous policy of testing, contact tracing, quarantine and social distances, and their number of new cases are dropping off quite dramatically. Now, I've been talking about flattening the curve. What China and South Korea have done is they haven't so much flattened the curve as that's the curve there. We were talking about flattening the curve like that because we don't want a curve that goes like that. But what they seem to have done in South Korea and China to a very large extent is to stop the curve. And they've done that with very extensive testing, which we're not doing in my country, which we haven't been doing up to now in the United States. Very vigorous contact tracing, attacking every case and isolating every case. Quarantine and social distancing. So, congratulations to South Korea. So China likewise reduced number of new cases, but there's been cases in China for from people that have flown from Spain and the United Kingdom, this backflow infection. Foreigners going into China are quarantined for 14 days at their own expense. And in China, there's a potential 6-year jail penalty for getting around regulations. For example, if someone has a fever and they take paracetamol or acetaminophen or Tylenol, it's all the same molecule, before they get on a flight to deliberately deceive the aeroplane screening, that is now an imprisonable offence. And new cases are reducing. I had an email from Paris over the weekend. People were out and about in Paris having fun. I don't know to what extent, but they really weren't taking this social distancing message to heart. Now, the United States has got massive community spread, and this number in the United States is going to go up dramatically now that testing is started. Now, about a week ago, I did say the Americans are getting their act together on testing now. And basically last week they didn't, but now it does look like they are. 2,000 labs are coming online in the next 4 days, 1.9 million tests this week. But for the American population, that's still not massive. But it will show a massive increase. There's no question in my mind that we'll be putting a naught on the end of that before very long, unfortunately. New York and Los Angeles, bars, and I believe the schools are shut down in both those cities now as well. Certainly in New York, the schools are shutting down. Illinois, Ohio going towards the closed down direction, closing down bars, restaurants. Curfews in some areas. Now, the travel ban into the United States, I've just seen videos from JFK, John F. Kennedy Airport in New York. 2-hour delay to be screened, and people were absolutely crammed together in queues, or what you call lines in the United States. Absolutely appalling levels of crowding in this indoor airport. If the infection is there, it will spread. The organisation there has been lacking. Especially then, the irony is the Centre for Disease Control, Atlanta, Georgia, saying that no more than 50 people should meet at once, and yet we've got all these hundreds of people milling around airports. Let's hope that's sorted out soon. California, entertainment places closed. Over 65s advised to stay at home. Now, the United Kingdom. That's our cases, that's our deaths. Now, we did work this out at a percentage yesterday. It was quite a high percentage. But of course, remember that there are 10 times more cases than this in the UK. Or even times 20. So the real number of cases in the UK now is 13,000 to 26,000 at an estimate in the UK. So the question is, how do we work out the percentage of deaths? So it's not really 35% of that, because that's only the cases we've detected, whereas deaths, as we looked at in the early Chinese data, are easy to diagnose. So this death figure we know to be accurate. This figure, basically we haven't got a clue. So what sum should we do? Is it 35 over 1375 times 100 to give the percentage? Or is it 35 deaths, which we know it's 35 deaths, over 13750, which is probably nearer the truer number of infections. And if that's the case, this is going to give us, I'm not going to work it out now, but it's going to be about 0.2% rather than that one, which is going to be about 2%. So that's a heck of a difference. Or if it's times 20 more cases, that's going to be nearer 0.1, isn't it? So basically, we don't know the death rate in the UK yet because we are grossly under testing. South Korea is testing just about everyone, and we're testing just about no one. We're only testing people who are ill in hospitals at the moment. We are in blatant contradiction to the World Health Organization advice and to what the Koreans and the Chinese have empirically discovered works. But my hope is that we're much nearer this figure for case fatality rate. the number of deaths per cases. I'm much hoping it's much nearer that one than that one. But at the moment, we don't know. Now, I've resisted doing this in the past, but anyway, I've done it now. So 65 million people roughly in the UK. If 70% become infected, which is a reasonable working scenario, that is 45 plus million people. Just to take my country as a case study. Now, if 12% of that 45 million get quite serious disease, that's 5.4 million in the United Kingdom. 5.4 million people in the United Kingdom are going to be quite poorly in the next 12 months. Up to the point where they may need some medical intervention. 5% of 45 is 2.25, so that's 2.25 million people over the next year who could be critical. So that's more than 2 million people potentially critically ill in the UK. Over 5 million people who are going to be quite ill in the UK over the next year, just to take my country as an example. The good news is 80% of us will have a mild or very mild illness. So that's 36 million people can expect to have a mild illness and make a full recovery quite quickly. But I think it goes without saying that no healthcare system in the world can manage these kind of numbers. And the import of that can't be overstated. This means because we can't treat all these people, the case fatality rate is going to increase. And it's the same situation all over Europe at the moment. Things all over Europe are about to get dramatically worse with dramatically more cases, as is the case in the United States. Cases are going to increase. Let's hope I've made some fundamental error here in judgment. Now, those over the age of 70 are going to be asked to stay at home for 4 months soon. Come on, let's hope it's today. Let's get on with this. You know, South Korea stopped the curve with testing, contact tracing, quarantine and social distancing. We need to do the same. Germany, a lot of cases. Again, can we say times 10 on that? I would have thought so. Restricted land borders. Italy, again, can we say times 10 on that? But the death rate is accurate there. Now, I got an email from Italy saying that a lot of people in Italy live in 3-generation accommodation. So there's grandparents, parents and grandchildren all living in one house very often. And of course, that's going to mean that the older people catch the infection from the younger people. And we know the older people have more complications from the infection. So that could be part of the reason that the death rate is high in Italy. And I've also heard anecdotally, I don't know if it's true, that people in Italy have been taking non-steroidal anti-inflammatory drugs, such as ibuprofen, for their fevers. And I've just made a video suggesting that that is a bad idea. So a couple of factors there why the death rate might appear to be high in Italy. But the main factor seems to be that the real number is actually much higher than that 24,000. But we know that the number of deaths is accurate. So again, as we saw with the UK example, the actual case fatality rate hopefully is way lower than the sort of over 6% that we've been calculating. Spain, terrible increase in Spain. Spain, like Italy, of course, is now pretty well locked down, huge areas locked down. And yet cases are increasing. But this doesn't surprise me. The lockdown in Spain and Italy, I believe, is the right thing to do. And I would expect the cases to carry on increasing for the first week because of the approximate 5-6 day incubation period that most people have. With these extreme measures, the quarantining and the social distancing in Spain and Italy, I would expect the new cases to start going down, but they need to do the testing and the contact tracing as well. France, tragically, is going the same way. Again, can we put times 10 on these numbers? Probably. Cases in France are doubling every 3 days. Now that is frightening. Doubling every 3 days. And France is starting to shut down. And there's no real question in my mind that with doubling every 3 days, France is going to have to go to the same kind of shutdown as Italy and South Korea and Wuhan province, because Europe is now the epicenter. That's just a few things there that have caught my mind. So basically, things are going to get a lot worse in Europe over the next week or two. Let's hope that these quarantining and social distances measures are going to be effective.